Kadhi mbele ni Migao mar thieth oyangoni jatuo manyocha ogamo guonyo ka ong'eche ma idendo ni monkeypox koro osechango. Kaluwore kod ler ma ogol kod jagoro mongere Migao mar thieth Mary Mudhoni, jatuo no osebedo ka imiyo thieth manimba ka apisa mag Migao mar thieth meneja osebedo ka timo nonro mar ng'eyo matut ewi guonyo no mongere kaka monkeypox. Mudhoni okoni Migao mar thieth medo keto kenge e tong' Kenya kod pinje libamba mag geng'o tuo no mano ochakore e piny mar Congo. Omedo ni kwayo jopiny mondo med luwo kenge duto mag geng'o tuo no.
At Taita stop border point on 23rd of July 2024, he reported having symptoms of 2 weeks prior. The patient was isolated at Taita Taveta Sub-County Hospital. Skin lesion samples were taken. Results from the National Public Health Laboratories detected Mpox on 29th July 2024. The patient has since recovered. However, due to the infectiousness of Mpox and as per international guidelines for Mpox response, the Ministry of Health and the County Health Department of Taita Taveta began identifying all persons that had been in close contact with the patient. The patient has traveled through Uganda, Kenya, Tanzania, and Rwanda. All counties have been advised to sensitize the public on the outbreak and requisite preventive measures necessary to avoid contracting the disease and also the steps to take when they contract the disease.